Some aspects of our lives, like sex, intimacy, and the changing landscapes of our bodies, demand to be talked about, not just once, but over and over. These are subjects woven deeply into our identity and well-being, and yet we often struggle to give them voice. Language itself can feel like a limitation. The words we have or don't have can flatten or distort the complexity of what we feel, what we desire, what we fear. We reach for metaphors, euphemisms, silence. We trip over cultural taboos and social scripts that tell us which parts of our bodies are acceptable to name, which questions are safe to ask, which desires are worthy of being heard. In a world shaped by centuries of social constructs, especially around gender, sexuality, and health, we're often left without the vocabulary or the permission to speak freely. And yet, this is exactly why we must keep trying. Every time we speak honestly about our experiences, about pleasure, pain, confusion, aging, healing, we chip away at those constraints. We make room for deeper connection, and we start to reclaim our bodies, not as problems to be fixed, but as stories to be told. Today, I am asking you to listen for the first time or again to my conversation with Jenna Smith Stout, certified midwife, about sex, pleasure, and finding our voices to speak out loud about our intimate lives. It's a busy summer. Thank you for joining me today. I hope you enjoy this replay. I've talked about sex on Gynocurious kind of from a variety of perspectives, but I've been thinking a bit more about why do so many of my colleagues avoid talking about sex in the office, and are these same folks avoiding conversations about their own intimate lives, even in their personal spheres? What are the barriers keeping so many clinicians from asking, are you in an intimate relationship and is it good? In the GYN office, we're talking about vulva, vaginas, and the pelvis is the rigor of the day. Why is it so difficult for so many clinicians and patients to communicate about sex, sexual functioning, and pleasure? Why is this topic so forbidden, even in 2024? So welcome, this is Gynocurious. I'm your host and creator, Dr. Amy Novatt. From both sides of the speculum, we are here to investigate what it means to be a healer and to be healed. Please send comments to comments@rhiniecliff.org or gynocurious@gmail.com. And consider right now as you're listening, take your phone out and whatever app you're listening, please give the show 5 stars and share with your friends and family. Jenna Smith Stout, a certified midwife working in Rhinebeck, New York, is back in the studio today. And I want to welcome Jenna.
Thank you, Amy. Thanks for having me here.
It's such a pleasure. So we're actually recording on November 30th. So we just all kind of celebrated Thanksgiving. How was your Thanksgiving?
It was so delightful. I had family up from Georgia, from Brooklyn. It was just rich and beautiful and connected.
Great.
Yeah.
I was thinking there's an African, I apologize, I forget which country, but there's an African tribe where the cultural norm is for everyone to speak all at the same time. Mm-hmm. And I was reminded of that at my Thanksgiving table. I was sitting there realizing that there were, I think, 15 or 16 people at the table, and literally everyone was talking at once, and everyone seemed to be engaged in some conversation, but I'm thinking, I want to listen to that, I want to listen to that, I want to listen to that. It was kind of chaotic, but it was the nature of my family.
So rich. We had a similar thing, and I remember thinking, my daughter cuts me off a lot. I cut her off a lot. Well, let's just both talk. And we did. It was great. It was very expansive and fun.
It's
lots
great.
of talking.
Good.
Interrupting, co-talking.
It's
yes.
true. Co-talking. I like that. So I know this, but our listeners don't know that you're about to make a big shift in your career, that you're going to move to GYN only, as we put it in the OBGYN world, after delivering babies, helping deliver babies for a lot of years.
Yes.
How does this feel?
Very exciting.
Great.
It's been a long time coming, I would say. I'm thrilled. I will be doing GYN only sexual health, breast care. I was just asked to take care of women who are at high risk for breast cancer. Well, I'm excited about it.
Oh, that's great.
Yes.
So much learning. So much learning.
So much.
Which brings me to the subject of the morning, sex.
Yeah.
In your training, were you taught about sex and sexual functioning?
Oh, gosh. In my midwifery training, it was part of the conversation, but there was no specific class. Yeah, so I have to say it was peripheral.
Yeah.
Yeah.
Same's true for, I don't know about now in OBGYN residencies, although from my understanding, just a very cursory review with some folks who are in their residencies, there's still very, very little conversation. But in my residency, not a moment, which was kind of interesting given that we were delivering babies. Like, how do you make babies? It's just bizarre how absent that tutelage was.
It is. I think there's a presumption that it's a big part of the conversation and the teaching. And, when I tell people what I do, they say, oh, how do you look at vaginas all day? What's that like? And there's a sort of energy around it. And I think, well, it's kind of like looking at like being an ENT and looking in someone's ears and nose. You get used to it to a point where it's not about sex when you're doing the exam. However, the conversation almost always goes there with the patient. So it's such an interesting kind of layering of how we're in our bodies, how we're disconnected from our sex, but how we're completely, it's so there. People are so ready to talk about it on the whole.
It's so interesting. I like data, and so I always kind of look stuff up as I prepare for my talks on Gynocurious. And I knew this, but I wanted to double check because I'd hoped that maybe it had changed since I last looked a couple years ago. But I'm reading now. So according to available research, only a relatively small percentage of clinicians routinely discuss sexual functioning with their patients. Estimates suggesting that around 20 to 40% of clinicians regularly ask questions about sexual health or dysfunction, with even fewer routinely inquiring about sexual satisfaction or orientation. Unless patients bring up this issue, physicians, clinicians are not asking about it. What is that about in your mind? Why? Imagine if that percentage, so only up to 40% of clinicians in the OBGYN world were asking about mammograms, pap smears, breast health, their periods. That would be bizarre, right?
Yes, it would be. I think it's cultural. I think, like you said, it's not in our training. I think in our culture, there's taboo around sex. Entree into the conversation isn't taught. Our families don't necessarily easily teach us about how to speak in that way, in a safe way, in an open way. But in terms of in the office, I don't have the answer why that isn't happening. I can just, reflect on what is in our culture, what is in our training. But it's so important. It's so important. It's critical. I think I'd like to say I speak to 100% of my patients about it, maybe more like 90. It's hard to say, but such an important part of our wholeness and our GYN care and our womanhood.
Yeah, I think that's a good start. Like, why is Amy talking about sex again, even though it's fun? Like, why is it so important? And what I'm always saying out loud as best as possible is that sexual health, intimacy, and I'm not talking about heterosexual sex only. I'm talking about intimacy, whatever way you like having it. And it could be embracing, it could be penetrative sex, it could be with anyone you want to have lovemaking with. That this is part of the quality of our life, our overall wellness and sense of wholeness in our body, the way we see our bodies. It's just so important.
And it starts with the self.
Yeah.
how do you relate to yourself? How do you relate to your body? Why do you relate to your vagina differently than how you relate to your nose? What's your comfort level? How well do you know your body? What do you want from it? Do you know? Is it even a conversation within yourself? So it starts with the self.
Yeah. And it always reminds me, language is so important in the world of medicine, but it's also so important in the outside world in addition. And I was reading an article recently about how Great Britain just passed legislation to make assisted suicide available to folks in Great Britain. And then some follow-up articles were using language that we're really talking about killing patients, killing people, and how different the language around assisted suicide versus killing brings a tonality, brings a perspective into the writing, into the message. And I think that's part of the way we talk about sex too, right? How we're brought up and how we talk about sex, how our friends talk about sex or don't talk about sex. And it brings me to how in the office, so often what we're doing is talking about dysfunction and pathology. And I wonder if we started the conversation about sex in the office first with, are you intimate? And does it feel good? Like, let's start there.
Yeah.
Whether that would be easier for our peers, whether it would be easier for our patients. I don't know. Your thoughts?
Yeah. Oh, well, I think about how I start the conversation. And it's usually asking, are you sexually active?
Mm-hmm.
And it's amazing to me what that question, how people hear that question.
I know.
What does that even mean?
Uh-huh.
Do I even know what I mean when I'm asking that question?
All it takes is a 23-year-old to walk in and say, what do you mean?
What do you mean? Or I've had answers like, with a frown, well, I'm married.
Oh, I love that answer. It's fascinating.
I have to say, as many women as I speak to are different types of ways of answering that and perceiving what that means. And I'm open. I feel like I have my catcher's mitts on, if you will, after I ask that question. I'm so love to hear the answers. And I love when I'm taken off guard. And I love when I don't get the answer because it keeps me honest. It keeps me on my toes. It keeps me learning, keeps me humble. It's a beautiful thing. But are you sexually active? No, because I only have sex once a month. Okay, so there's an interesting answer.
Right.
I've heard that having sex less than once a month with your partner means you're not sexually active. That's what a beautiful entree into conversation about what does it mean and what does that mean to you? Do you want something different? Do you want to change your perspective? Is that, true? Like, what is true for you? So there's so many layers of how we get in there. Amy, I even forgot what your question was. I'm just rambling.
No, you're answering the question. We're talking about language.
Yeah.
And I got off on this Great Britain thing. This is what I do.
I got you. Yeah.
But it strikes me that in a way, we've been trained to figure out pathology.
Yeah.
And then figure out treatments for that pathology. And I think that the moment we just assume that there's pathology in sexual experiences or in intimacy, that brings a certain tone into the office setting that may not be the right one to start the conversation.
Yes.
Now, I also am not naive. There are a lot of vulva havers out there whose sex is not pleasurable. It is not enjoyable. It's filled with history of abuse and violence. I'm not naive to that. So again, what is the most respectful way in which you and I, and we can teach our colleagues, how to enter this conversation in a respectful, open manner?
Yes,
that's what I'm trying to get at.
Yeah.
And you just answer it. Yeah.
I think we are not actually the ones to decide if there is sexual dysfunction.
Mm-hmm. Well, we know that actually, right?
It's so profound in that way. You might think, oh, well, you're not having intercourse with your male partner. okay, there's some dysfunction there. No, that's not necessarily the case. That could be this is what is beautiful and works for you. Just going into it with this almost, an openness, but a question mark and a real listening.
Yeah.
Listening.
Absolutely. In fact, the current guidelines around sexual dysfunction, if you come to a diagnosis, if you will, is that the patient is distressed.
Yes.
That's the key feature of it.
Mm-hmm.
So just as you point out, let's just say a perimenopausal woman starts talking about how her vagina doesn't feel good anymore with sex. Mm-hmm. But oh my, she's discovered oral sex, or she's discovered fondling in other ways that bring her to orgasm even faster than vaginal intercourse brought her all those years. She's not distressed about this at all, for example. There's no dysfunction.
Right.
Right?
Right. And maybe there is that newness, learning and a new frontier of feeling good sexually, and in addition, some dysfunction. It's not one dimensional either. Like we're so complex.
Right. And maybe some of the language we need to change is dysfunction. Maybe it's about change. Mm-hmm. Maybe it's about what's not working for you, and just leave it as if you will, global as possible. Mm-hmm. Right?
Yeah. How do is there a desire to have a conversation around improvement or expansion or learning in addition to the good things that are happening? But this we need to tweak, so to speak.
Right.
It's
right.
Yeah.
Yeah.
And I really do feel like as many women there are out there are as many different approaches to sex or feelings about it, or their, attitude about their own body. Like it's just such an incredibly layered, rich topic, if you will. Yeah.
Absolutely. Mm-hmm. Absolutely. What interests me too is kind of the history of the study of sex. And what interests me is that, in the late 19th century, sexology, which was, the coinage or the phrase that we came up with in the world of medicine for the study of sex, was all about mental disorders. It was all considered part of, in fact, there was a German researcher who published Psychopathia Sexualis, was the name of his publication. And it was the beginning of scientific examination of sexual aberrations within the psychiatric domain. Then you go into the 1920s, where endocrinology started being studied, and we began to get a better sense of kind of the biology, if you will, of sexual functioning. And then there were Masters and Johnsons and other people who really did amazing work trying to understand the biology, if you will, of sex. But what's fascinating is, even though we know that when one looks at sexual health, one should look in a kind of biopsychosocial realm, like everything from the biology to the psychology to the social, that there's just so many layers, as you've pointed out, that contribute to our sexual experiences in nature and exploration, that even in today, the sexual dysfunctions or diagnoses of dysfunction remain in the DSM, which is that the Diagnostic and Statistical Manual of Mental Disorders. Mm-hmm. It's used by psychiatrists and psychologists throughout the world. And so it still remains within the psychology and mental disorder realm, which I thought was just fascinating.
Well, and the irony of that is they don't know anything about it.
Right.
I was just talking to my daughter. Okay,
let's go there. Yeah. Tell me about it.
I was just talking to my daughter, who's a fellow at a Harvard child partial inpatient program. And she's very much into the world of psychology right now, and she goes off on her ideas about what's good. But always in the end of what she's saying is, we don't know anything in the world of psychology. We don't really know how the brain works. Of course, that's not entirely true, and she knows that, and we know that, but there's so much we don't know.
Yeah.
So fair enough. Okay, it's in that it's that, in the DSM and that, but what does that mean? Are we just punting it to someone else to handle it?
That's right. Well, we're certainly, to me, it implies that we're still a little bit back in the 19th century of like, oh, this is a mental disorder, which of course brings in the stigma and the misogyny and the way in which medicine has always looked at women and women's bodies. Now, we have come further, but
Yes,
it just strikes me that this remains the tome that has this information, and it's there you go to find out, if there's a diagnosis or not.
Right.
It's just curious.
Right.
It's just curious.
It
yeah.
is.
The cultural expectations around sex and the conversation about sex is so intriguing. Again, there's families that have open conversations. I mean, I've interviewed some students in the studio who are so sex positive, are so comfortable using language that I didn't use, even as a an outspoken, bold feminist at 21 years of age. I didn't use that language.
Yeah.
And I realized it's all about the way my parents spoke about sex. So despite being liberals, they just didn't talk about it.
Yes, same in my family. We didn't have a sex positive culture in our family, but it makes me think. Just today, when my cousin was leaving, we grew up together. She was with us for Thanksgiving, and she was leaving, and she said, "Oh, what a great Thanksgiving! Have a fun podcast about sex, and just remember, you helped me 25 years ago before we had babies." She reminded me that I gave a gonorrhea presentation to the family over Thanksgiving about 25 years ago. It was when I was in nursing school, I think I had to do some presentations. So I did when I had, big built whatever, flashcards, pictures, everything, and gave a presentation to the family. My aunt was, kind of going, and asking lots of questions. And it interestingly shifted the culture in my family from being clammed up, quiet, not necessarily sex negative, but sex
reserved,
neutral, sex absent, to sex positive in that moment. And so it kind of stuck with my cousin. And I love to see how that can change. But yeah. It's hilarious. When she left, she waved and she said, "Remember, you changed my perspective 25 years ago."
Well, I think what you're bringing out, which I just so appreciate, so thank you, is the laughter around it, the joy around being silly around it, the pleasure of speaking about sex in an open way that with a sense of humor is just so empowering and uplifting and helpful. Because for again, whatever reason and all kinds of reasons, it's been relegated into this very, this serious pot, if you will. You have to be serious to talk about it, and there's very serious, potential complications like infections, like unwanted pregnancy, violence against. Those are part of the stew, but there's also such great fun around it too.
Yes, there really can be. And then in the office setting, to bring it back to, working as a clinician, there are boundaries and edges to it. And then, how when raising our kids, a lot of us kind of let the kid lead us in terms of what they want to learn and know and take those cues. Well, that's also something to think about in the exam room as a provider. Well, does this person want to have this conversation? As I have to be careful of my agenda. Do I need everyone to be sex positive? No, I got to take a look at that. Be careful about how I'm leading the conversation, but how do we open the door and hear where people want to go with it? Open the door a little more because maybe they want to go down that road. So where are the boundaries for us as providers? It's an ongoing question.
Yeah, and I always remind my colleagues that this is not a conversation you're going to have only once. That this is a conversation that hopefully you can have every time you see this patient. Because as you're pointing out, our patient may say, I don't want to talk about this with this new provider. Mm-hmm. And then the patient sees you again and again, and you demonstrate empathy and openness. And then all of a sudden you ask the same question you've asked already 3 times. And there's an opportunity for that person to open up a little bit and open up gradually over time. So for those of you out there listening who might be clinicians, remember, you're not going to want to push this conversation in a way that's insensitive to your patient. And to women out there who are seeing gynecologists or family doctors or urologists, places where sex should be talked about each and every visit, quite frankly, of course, I think so. Know that you don't have to jump in the pool all at once. You can open the conversation up to just a little bit. A lot of it. I mean, that you get to be the guide here.
Yeah. And you don't always have to have all the answers.
Oh,
and
my gosh.
That actually may be one of the reasons it's not approached enough as a conversation in the office, because as a provider, I think we're accustomed to feeling that I have to have all the answers. I have to have the solutions. I have to know the medications that will be appropriate. What if I don't know? It's a vast conversation. It's a vast field, if you will. And sometimes we don't have it. And often people just need to talk about it or ask one question or test the water with that trust with your provider. The one question, okay, we'll talk about it again in 6 months or next year. But as a provider, you don't have to know the answer, and often there isn't an answer.
Or there's a role in referral. Let's just say that you elicit enough information that you realize, some of the sexual challenges here are really about a history of trauma. And that I'm not an expert in trauma and healing from trauma. So I'm going to have my list of therapists, sexual therapists or otherwise therapists who are experts. And I'm going to ask the patient or recommend the patient take this first step, and that may be the best approach. And you're right. There's only so many medications out there for sexual challenges. And that often what I'm talking about with people, because I'm interested, but I know a lot of my colleagues aren't, is the psychodynamic, is the conversation about what's going on in your partnership. Oh, yeah, you're really not digging your husband anymore? Well, that's gonna be an issue. Or, your partner wants other partners in the bed and that's not quite comfortable for you. Let's talk about that. That there's so many, again, psychosocial, logistical issues that go on that filter into our intimate lives. Yeah.
And you and I have talked a little bit about, wouldn't it be great to have a sexual health clinic?
Oh, yeah. Now you're talking my fantasies.
So seriously, that, have more than one type of provider available that we can work with. So, yes, we have to have our list of people we refer to for various reasons with urology or psychology or whatever it is. But wouldn't it be great to have that conversation together? Okay, I see you today. We talk about this issue. Come back next week and see our urologist or see our massage therapist who does my abdominal massage, or see our psychiatrist to talk about medications, or social worker to talk about it more, to dig in more in a way that I don't think I would be, I wouldn't serve you the best.
Right.
We can open that conversation, and then to work as a group. Oh boy.
I know. Fantastic.
Yeah.
Fantastic. And they exist, but they're very few and far between. And part of it is the financial model is a difficult one in the face of medicine today. And again, there just aren't perhaps enough opportunities for people to really explore this as clinicians, because they're so busy doing the rest of gynecological care or family practice care or urological care, etc. Yeah.
True.
Yeah. So it's I think part of the reason we're having this conversation is I wanted to be able to make sure that our listeners appreciate that the hesitation to have this conversation is not only coming from the patient sometimes, but certainly the clinician. And then until someone raises the question, it may not be spoken about. So to empower everyone out there listening, if you've got a question about your intimate life, ask the question. Now, will everyone respond in the way that you want them to respond? Maybe not, but I want to suggest bravo if you've asked the question, and 2, seek out another person to speak to about it, because it's such an important part of your life.
It really is. If you ask the question and it opens the door to a good conversation, wonderful. That relationship can continue. And if you ask the question and there isn't a resonance, they're not understood or answered, then maybe you need to find an additional provider or a different one to delve into those concerns. Yeah.
And I'm going to be a little sexist here. I know a number of my patients have said to me that they never had a conversation about sex before because their clinicians were male, and they felt great reservations about bringing this issue up with their male doctors. And I get it. I understand that. But there are certainly wonderful male physicians out there who are able to talk about this. But if you're not feeling safe, comfortable doing so, then try to find a person who's women identified and who's willing to talk to you about this stuff.
And then, right. And the sexist part is real too, because one might think, well, a woman will be better at this. And sometimes you might be surprised.
Oh, you bet.
Yeah.
You bet. You bet. So we have talked about the perimenopause and menopause on Gynocurious quite a lot and from different perspectives. But I just want to go there with you because I don't think that we can talk about it too much.
No, we can't.
Yeah. And I want to just tell a little story because it resonated so much with me. I went to see the M Factor. It's this new film about the menopause and perimenopause that PBS is airing. And there was a local showing. And throughout the film, they're interviewing all these different clinicians from different parts of the country about the perimenopause and menopause. They're interviewing some patients, and it's a really good film. There are some limitations, I think, some science I didn't think was quite spot on, but it doesn't matter. I so applaud the person who made this film. It's great. But so they're talking about vaginas. They're talking about hormone therapy. They're talking about everything. Then there's a scene where there's a group of people who run an organization, an IT firm that's trying to really be proactive in supporting women as they move through the menopause. So talking about days off during the menopause, like just being really honoring. And they're talking and they're having this really rich conversation, and all of a sudden someone brings up sex and the whole room starts to giggle, starts to laugh. And I thought, isn't this interesting? Here are these really educated, really progressive, really interested people who have a little bit of embarrassment about sex still. And it's like, wow. Yeah. It's so pervasive.
Yeah. Isn't it so funny? And then when we start laughing, then there's that oxytocin release, which then brings up all these feelings, which, it's absolutely, people get giddy around it. It's like when people start talking about chocolate.
Exactly.
Oh, yes.
Exactly.
It opens up the floodgates. Yeah.
So it's a terrible irony that we don't talk about it more because it would just make us all feel so happy. But let's say we're not happy about this, meaning, I remember when I went through the perimenopause and all of a sudden my vagina just started changing and I was like, what the heck is happening here? Yeah. And it's, again, here I am open about it, but still there was a sense of, how do I put it? I mean, I want to say maybe shame. It was, or shame or embarrassment or, oh, I'll take care of this on my own. That was probably the majority of the feeling I had was like, oh, I'm going to take care of this on my own. But then I was taking care of my children. I had a full-time practice. I was taking care of everybody else's vagina. My poor vagina was just aging.
Right.
Let's talk about the perimenopause and let's talk about kind of how your personal experience, and that's why I share mine, it's, how your personal experience may have shaped the way you think about it vis-a-vis your patients.
Yes. Well, I will say that the vast majority of my patients are there to see me because of issues around the perimenopause. So that is a an ongoing conversation that I continue to be very passionate about and actively learning about. And I mean, in my personal life, yes, the perimenopause and the menopausal years changed everything. Some of it was, very, very difficult. Like, what's happening to my body, my skin, my breasts, my vagina, my sex life? What's going on? And some of it is really better. So yeah. I have two dear friends who are around 60, and they both felt that they were done with relationships. They were single, done with relationships. They both met male partners around the same time, coincidentally, and started having these wild sex lives. I was so envious. I got all the gory details. It was fantastic. I mean, and one of them said, "You just try to get me pregnant." I mean, she was like, what, how blissful was it to have as much sex as often as you want and not worry about getting pregnant?
Yeah.
And to her, that just opened up all of her channels. I mean, she's, been on fire for the last year. And very similarly to my child isn't in the next room. I can scream and shout and have sex 5 times a night. And I'm going, wow, there are these fantastic advantages, if you want to call it that, or silver linings to having sex postmenopausally. And then there's a flip side. Yeah, like, wait a minute, whose vagina is this? It's like dry and pale.
Are you my vagina?
Are you my vagina? How do I get my vagina back? And, we have all sorts of tricks of the trade, how to, make the vagina more estrogenated and feel more elastic and more comfortable. It's a process, but it's very exciting to talk to women about that kind of re-estrogenating, or however you want to couch it, but how to be able to feel good again in your vagina after menopause is a really great conversation. It's very exciting and expansive, and like, oh my God, I didn't know I could do that.
Yeah. Absolutely. And again, to remind the listeners that sometimes it's a really simple fix. It feels like a problem that could not be resolved, but it can be. It can be, and it's not always about estrogen. It can be about other products. But again, unless we mention it to our clinicians or say it out loud to our partners and have a conversation with someone about it, it doesn't get fixed.
And then there's the question of libido.
Oh, that
thing. I love that thing. Where is it? Where does that live in my body? Is it in my mind?
Again, it's a rather delicious dichotomy. There's a part of it that I hear women say, like, "Oh, phew, I'm not walking down the streets anymore, like lusting after every gorgeous thing around me." And that's kind of a nice break. I don't have to expend my energy there anymore. And then, of course, there's the other part of it where it's like, where's that juiciness? Where's that lust? Because lust can be so delicious.
If we could turn it on and off.
Oh, I know. Maybe we're just missing the button. It's somewhere.
But I think about, now that I'm postmenopausal, I think, oh my God, my hormones drove me. Hormones drive us. At least I see it that way. Like, the things I did. 12-hour drives. Right. Mountain climbing. I'm like, what we do that are like, we're driven by this. Almost feels external, but it's internal. It's as deep as
biology, it baby.
Yeah. And then menopause comes, and that particular drive really shifts. And you think, where did that go? I'm almost like I'm free. So like the kind of fun, or maybe a good part of it is like, oh, I'm free of that like thing that drove me and blinded me and made me make these crazy dumb decisions, or fantastic wild decisions. But so there's this clearness, but there can also be a like, yeah, where did that go?
It's
Where
a
is
loss.
that delicious
Yeah.
wildness that comes with our hormones? No pun intended. Oh, yeah.
It reminds me how I try to be really honest in this conversation. And I don't want to talk about this perimenopause, menopause / sex phenomenon in just the negative. I also don't want to just talk about it in the positive, because for most vulva havers, it's a combination. There are persons who, stop having intercourse or any kind of penetrative sex at a certain age, and there's a loss there. Now, hopefully they found some creative ways of being intimate in spite of that. What can happen for some is that they say, oh, I can't do it the old-fashioned way or the way I'm used to. I'm not going to have it at all. And I would beg people out there to not go down that road.
Right.
Because there are a lot of erogenous zones.
Yeah.
There's a lot of learning that can continue until the day we die about how our body can be pleasured, how we can feel close to someone. I like to say sometimes holding my husband's hand is like the sexiest thing out. There's an intimacy there. I can't explain it.
Yeah.
For me.
Yeah.
But, is it do it for everybody? No, of course not. Right. So it's about exploration and investigating for your own self what does it. And then, of course, communicating with your partner or partners. It's key to it. It's so key to it.
It's such a great conversation. I was talking to a friend the other day about it and about, how do you keep sex alive? And, I want to use air quotes around that. How do we stay connected? And her partner is older and having a little erectile stuff going on, whatever it is. She was such a great conversation, and I wanted me to think of this, but she was teaching me in this moment, and just a sort of a free form conversation. She said, I think I was talking about libido and how women are postmenopausally are often looking for their libido, the search for libido. How do I get it back? How do I want my husband or my partner or my lover or my girlfriend, whatever it is? How do I want them again? I love them with all my heart, but I don't want them. I don't feel like having sex, but I want to have sex. I want that, the glue, the connection, the juice to be there. And she said so matter-of-factly, you just have to do it. And I thought, wow, that's such a kind of a worker bee attitude. Like, get to it. Do it. Like, even if you want it in your mind, but your body isn't feeling it, so you want this thing, so make it happen. It was so just pragmatic. I thought, okay, well, I'm waiting for that moment of, I want lust to take me over. I want to look at my partner's ass and want to jump his bones, But where is that feeling? Oh, it's kind of not there anymore. And not for lack of love or wanting of that part of our partnership. But she was just kind of like, it was like a slap in the face. I loved it. It was so great. Like, there's that piece. You got to set aside the time and make it happen. Do it. Like, she gave some examples of what you could do.
It's true.
And sometimes, like, we're coming at it from the other side postmenopausally. I want to just say, in our earlier years, we might feel driven to it because of these hormones, like I was talking about before. But postmenopausally, if we're not having that feeling, our mind will drive us to it, and then the body gets connected in usually. Often, well, I shouldn't say usually, actually, but that's the hope. If our minds bring it, let's do this, baby.
Yep.
Let's light a candle, or let's watch some porn, or whatever is hot, or
Make
something we've never done before.
That's right. That's right. It's never, never too late to learn new things.
Yeah.
Masters and Johnsons. Yeah. Masters and Johnsons used to say you had to get desirous and then to get aroused and then to have orgasm. Well, what we've learned since that time is it's not so linear, and that for many women, particularly in the postmenopause, they have arousal first. Because let's say your partner initiates it and you're like, ooh, honey, that feels good. I'm getting a little juicy here. I want a little bit more. And then the desire steps into the bed, right?
Right.
So it's creating opportunity. We call it date nights. We call it putting an X on the calendar. Whatever it is. And I think I am talking about porn is a whole nother kind of podcast, but I am all for using imagery, words, toys, lubes, massages. I mean, whatever it takes, as long as it's consensual and nonviolent. I am for it because, what you're pointing out is the mind is so much a part of sexual play. And I don't know, if I'm thinking about what I'm making for Thanksgiving while I'm trying to make love, I'm not getting very far. I'm way down the menu road, right? Not really.
What am I going to put in the stuffing this year?
Bedroom. So taking your mind and putting it somewhere sexy, as some people call it, sexy time, like creating some boundaries around it so that other stuff doesn't come in.
Yeah. And I love as we get older, we allegedly get more mature, right? and I love the idea of bringing in ideas, concept, like you said, toys, kink. There's a taboo of porn, kink. Oh no! Wow. Well, what if you get a strap on?
Right.
Why not? And then that could be hilarious. It could be hot. It could be totally horrible and stupid. But why not? And also sometimes pleasuring your partner if you just don't feel like it, but you want the connection. Can you pleasure your partner and just be get a foot massage in return or whatever it like? How do we break the mold of this love connection, this sex connection? Like, I want to crack it open.
Yeah. Well, and particularly, your two friends who are in new partnerships, part of what makes new relationships fun is the unknown, right? The exploration. So I've been married 37 years, something crazy like that. And also, you like anything else in our lives, there's a certain ritual or step-by-step way of doing things, whether it's preparing our breakfast in the morning or the way we speak to our kids in the afternoon or the way we make love at night, may have a certain amount of rigidity, no pun intended, to it. Like, you do step 1, step 2, step 3. And what we're talking about is like, mix it up, like have it change. Because again, part of what's great and sexy is the unexpected, what we're exploring in our partners and in our own bodies. Yeah, have
there's
fun with that.
something nice about knowing what turns your partner on and doing that over and over again. However, why not? You got that. Right?
That's right.
But what's next? How do we open it up and feel more alive and connected, if that's the goal?
Yeah.
And how do we bring that into the exam room?
Laughter.
Yeah.
Laughter, I think, is part of it. I still do. I have a box of toys, and it brings laughter every time I show somebody something.
Nice.
And there are a lot of folks out there who don't want to go on the internet, who won't walk into a sex shop. And quite frankly, they might never have held a dildo. And they're just imagining something that's not quite the reality. And so it's again, it's exposure. So if you have a friend out there who's a little bit more sexually curious than you might just, join them and go for a ride and go to a sex shop or go on the internet incognito and, explore it. There's a vast world out there, and finding what appeals to you and your partner could be really fun.
Yeah, could be really fun.
Yeah.
I was just talking to another friend. So on the flip side, I was just talking to another friend who's been married to the same man for, I think, over 20 years. And we had never talked about sex before. And we got into it. And she said, yeah, well, we have sex most nights. And I'm like, what? You've been married for 20 years? And she said, yeah, we go through months at a time where we have sex every single night.
Wow.
I'm like, yes, go girl. Go girl, like, what is that? So she may not need to have any conversation with her provider.
Right.
Or it,
That's
like,
right.
again, brings me back to, as a clinician, I have to be careful about my agenda. Do I feel the need to open people up and talk? Well, not everyone really needs to or wants to.
Right.
And not for the wrong quote, not because of a fear of it, but because it's just good. All good.
All good.
Imagine that.
All good.
How
That's
beautiful.
Right. That's right.
And that's true for many people.
Yeah, that's true.
So I'm just saying that to remind myself of to keep my mind open as a provider.
We make so many assumptions. And just to give us a break, we make assumptions, but part of it is we're trying to be open and forthright about this conversation.
Absolutely.
So again, asking each other how we start these conversations, putting the assumptions aside as best as we can, figuring out a question that is just inviting, non-judgmental is our goal. Yeah. Are you sexually active? Maybe that's not the right question.
So and I started thinking about
language.
that.
Yeah. So, well, we could go on. We should just create our own language around this. Maybe
I like that.
The jargon in medical offices just fails it.
Yeah.
Completely. So, as you might have remembered from our last visit together here at Gynocurious, I love to end this conversation with pleasure. And you started by telling us about your pleasurable Thanksgiving celebration. What do you do on an individual level that gives you pleasure? At the end of a long day or at the beginning of a early morning sunrise?
I have some visualizations I do in the morning to center myself, to remind myself of my wholeness and connectedness to myself and my family and my loved ones and the planet. So I have my visualizations. And in the evenings, I love to connect with my friends and my husband and certainly my kids if they'll have me. And moving my body.
Yeah.
I always have to remind myself to move my body, to feel good in my body and do some self-care, physical self-care.
Yeah. Great. Thank you, Jenna.
Thank you for having me, Amy. It's always a pleasure talking to you.
It is a pleasure. And thank you to Jen Hammoud and Matty Rosenberg, my co-producers from Gynocurious. Thank you for joining me and listening to Gynocurious again. Until next time, please stay well, listen to your instincts and intuitions. They are the greatest of teachers, not to be ignored. Be well.